Telehealth is a virtual outpatient clinic that provides telebehavioral health services to individuals and families across the state of California. What we're really about is really high-quality, evidence-based clinical services. And the technology is simply a means by which those services reach those who need them.
One of the things that I think is most exciting about telehealth is that we provide opportunities for access and flexibility that there maybe isn't in other places.
What telehealth is looking for in partnerships is first that champion who can introduce telehealth as an option to those who might benefit from it.
Many of our clients come in with past trauma or they're in crisis situations. During the assessment intake process, we will describe what services we offer, and one of them is USC Telehealth. USC Telehealth has definitely improved outcomes for our clients.
Anyone who has a reliable internet connection can participate in telemental health services.
We had a client who wanted to work on driving on the freeways again. He was very concerned after having a car accident. The therapist and the client brainstormed together, so what would be the next step? They decided that the best thing to do next would be to go to a parking garage that overlooked the very busy freeway that he had had the accident on. He was able to park in a very private location, so no one knew that he was there doing a therapy session, but he could see the freeway very clearly. So he looked down, saw all the cars moving on the freeway. They talked through what that was like for him and what that experience was like. I'm excited to say that at the conclusion of this treatment, the client was driving on the freeway again, and he felt that this opportunity to talk about it, to see it as he was working with his therapist, it was really helpful for him.
So we've relied on developing relationships and partnerships with our community-based agencies because they're the ones on the ground. They know what the needs of their communities are, and they've also communicated to us that mental health services are always insufficient for the type of demand that their clients are communicating to them.
We worked with a mother and a daughter. The family had come in wanting to resolve some concerns they were having about daughter going away to college. Daughter was already gone. She was living in the dorms, so it wasn't realistic for them to come together once a week for a face-to-face traditional therapy appointment. We connected the daughter from her dorm room, we connected mom from her home setting, and they were able to talk through some of those adjustment issues.
As a program within the USC Suzanne Dworak-Peck School of Social Work, we have all of the resources that the school and the university can bring to a service like this. Our providers are a combination of both licensed clinical social workers who are all faculty at the school, as well as MSW interns who are enrolled in our graduate programs.
Our MSW interns first participate in a 6-week training period, which actually accumulates to about 100 hours of work, where they participate in live trainings, they're watching async sessions, also engaging in role plays and observations, all in preparation for their first client.
That's something that's really good about the training of telehealth. They give you that solid foundation to feel confident as an intern doing therapy.
I think that telehealth can be particularly effective whenever we're working with groups that are socially isolated and otherwise have a high level of stigma around seeking mental health care.
With telehealth, you can log in from your home location, you can log in from your office if you've got a private setting. You can do both. We have clients who sometimes will go back and forth depending on what their week and day brings to them. That ability to log in from anywhere that is private and secure is a really helpful piece for them to be able to get the help that they need while still running their very busy lives.
Many individuals acknowledge that they have a mental health need and they're willing to seek help. At the same time, they don't have ready access to it, and that's where telehealth can provide a solution that otherwise wouldn't exist.
I would definitely recommend USC Telehealth to other providers. It's a benefit to any community center, any kind of agency that's trying to help and support families.